the carcinogenic agents which are going to inflict genetic damage and leading towards the carcinogenesis. It is further divided into the three categories. The number one is chemicals, radiations, and the microbial products includes viruses and the bacteria. Hundreds of chemicals have been shown to be carcinogenic animals, and the chemicals are divided into the two categories: direct acting agents and the indirect acting agents. Direct acting agents are itself a carcinogenic. They don't require metabolic conversions to become carcinogenic. They are typically weak carcinogens by nature, and some of them are related to the chemotherapeutic agents. Means some of the drugs used for the Hodgkin lymphoma cases are itself work as a direct acting agents, and like alkylating agents used in the Hodgkin lymphoma, they are causing secondary form of cancer like leukemia in these type of patients. The situation is more tragic when someone is taking these alkylating agents for non-neoplastic disorders like rheumatoid arthritis or the gallomatosis with polyangiitis (GPA). And in these type of patients, the chronic use may be a risk factor for secondary induced cancers. Though the risk is low, but its existence showed that if you are taking these type of medicines, then it should be in a low, or it should be in a cautious manner. Indirecting agents, these are refer to the chemicals that require metabolic conversion to an ultimate carcinogens to become a carcinogens. Indirect chemicals, carcinogens, are polycyclic hydrocarbons that are formed with burning of the fuels, plants, and the animal materials. A chart is shown over here showing the direct acting carcinogens, and the top are alkylating agents. As mentioned, these are itself are able to cause cancers. And the others are indirect carcinogens chemicals, and these are polycyclic hydrocarbons. And the enzymes pathway that are involved in these type of indirect acting carcinogens is mediated by the cytochrome P450 dependent monooxygenase. All direct and ultimate carcinogens contain highly reactive lactophilic group that form chemical adduction with DNA, proteins, and the RNA. The mutation of the important cancer genes occurred RAS and the T53, which are tumor suppressor genes. They are responsible for the carcinogenesis. The specific chemicals, carcinogens like aflatoxin B1 produce characteristic mutation in the TP3 genes, which is tumor suppressor genes. If the tumor suppressor genes going to be mutated, and such detection of mutation within the particular codons, which are by the aflatoxin B1, and if mutation is there, so it leads towards the cancer. Aspergillus is a mold that goes on improperly stored grains and nuts, and it releases aflatoxin B, which is naturally occurring agent produced by some strains of Aspergillus, and it causes further hepatocellular carcinomas. In summarizing chemical carcinogens, they are highly reactive ectophile groups that directly damage DNA, leading to the mutation and eventually cancers. The direct acting agents do not require metabolic conversion to become carcinogenic, while indirect acting agents require a metabolic pathway, and the enzymes like P450 cytochrome is used for this conversion. After exposure of a cell to a mutagens or an initiated tumorigenesis can be enhanced by exposure to promoters, which stimulate proliferation of mutated cells. The examples of direct agents are alkylating agents, and they are also used for the chemotherapy. Indirect agents are benzopyrene, azodies, aflatoxin, and tumor promoters. Radiation, whatever its source, like ultraviolet radiations or rays of sunlight, radiographs, nuclear fusions, and the radionuclides, they are established causing carcinogens. Like if minors who are not taking unprotected measures to avoid radioactive elements, hazards, so they are more prone to develop lung cancer. And the cases having the atomic bombs like dropped on Hiroshima and Nagasaki, they are the cases of incidence of leukemia after 7 years of period has been documented. Also, thyroid, breast, colon, and lung cancers has been seen in these type of areas which are going after the atomic bomb. Therapeutic radiations for the head and neck cancers or the tumors can also causing the thyroid cancers, specifically papillary cancers are going to develop after the therapeutic radiations of the head and neck region. It's related to the mutagenic effects in the form of or the chromosome breakage, chromosomal rearrangements such as translocation or inversions. Naturally drive ultraviolet radiations in the form of sun can cause skin cancers like melanoma, squamous cell carcinoma, and BCC, which is basal cell carcinomas, and usually seen in the fair skin peoples in the Australia or the New Zealand, or the one who are going exposed to the sun bath. The extensive exposure to ultraviolet lights causing the repair system to be overwhelmed, and the skin cancer results. The inherited diseases, there's xeroderma pigmentosum, which have a defect in the nucleotide excision repair pathway. So if the repair pathway is defected, then also they are predisposed to the skin cancers. So in short, radiation carcinogenesis causes chromosomal breakage, chromosomal rearrangements, or point mutations, any of which may affect cancer genes and thereby drive carcinogenesis. Ultraviolet radiations or the ultraviolet rays in the form of sunlight, they induce the formation of pyrimidine dimers within DNA, which leads towards the mutation that can give rise to a squamous cell carcinoma and a melanoma of the skin. Microbial oncogenesis, or the viral or the bacterial one, oncogenic adenoviruses, the one important is STLV1, known as human retrovirus, human T-cell leukemia virus type 1, which are going to cause T-cell leukemia or the lymphoma. These T-cell leukemias, which is endemic in Japan and the Caribbean, the STLV1 genome encodes a viral protein called TEX, which stimulates proliferation, enhances of cell survival, and it interferes with cell cycle controls. Oncogenic DNA viruses, 5 DNA viruses, common one, HPV, Epstein-Barr virus, Kaposi sarcoma, and polyoma virus called Merkel cell virus, and the hepatitis B virus. In oncogenic DNA viruses, the important one is HPV, human papilloma virus. They've got many strains and also causing benign lesion as well, like squamous papillomas known as warts commonly, and genital warts also there. They are low risk HPV, and predominant they are HPV 6 and HPV 11. In contrast, high risk HPV, which are type 16 and type 18, and they are the one which are going to cause cancer, particularly squamous cell carcinoma of the cervix and the anogenital regions. though they can cause oropharyngeal cancers as well. The high-risk SPB 16 or 18 encode oncogenic proteins and they inactivate RB or P3 genes, which are tumor suppressor genes, and then if the tumor suppressor genes are mutated, then the tumor cells going to grow, or the proliferation of the cells occur into the cancer or tumor. Epstein's virus is a member of the herpes virus family, and this is the first virus which linked to a human tumor, Burkitt lymphoma. Burkitt lymphoma is a aggressive tumor, and it is endemic in some areas like in Africa, though they are sporadically occur anywhere. Epstein-Barr virus affects on the normal B cell, and these viruses uses the complement receptor CD21 to attach to and infect B cells, and this can lead to a proliferation of B cells and generation of immortal B lymphoblastoid cell lines. Hepatitis B, which is a DNA virus, and hepatitis C, which is RNA virus, they are capable of causing hepatocellular carcinoma, which is very strong affiliation with this, and it is estimated 70 to 85% of hepatocellular carcinoma in the worldwide are caused by the HBV or the SCV. Talking much about the viruses, there is also a bacteria which can cause cancers or the lymphomas, and it is Helicobacter pylori. In my initial tutorials and practicals, I already mentioned this about this bacteria, which is a bacilli rod, and it causes the gastric adenocarcinoma and a gastric lymphoma. If this organism is residing in the stomach for decades, then it may cause adenocarcinoma and gastric lymphoma. Like those of hepatitis B virus and hepatitis C virus, the H. pylori genome also contains genes which directly causes oncogenesis. The strains associated with the gastric adenocarcinoma shown to contain a pathogenicity island that contains cytotoxin associated A gene, CAGA. As said earlier, it also causes, H. pylori also causes or associated with the gastric lymphoma, the MALT1, which is mucosa associated lymphoid tissue, or referred to as the MALT lymphoma. The H. pylori causes lymphoma as well. The gastric lymphomas are of B cell origin, and because the transformed B cell grow in a pattern of resembling to that of a normal mucosa associated lymphoid tissue, so they are known as MALT lymphoma. In summarize these oncogenic DNA viruses, HPV, which is associated with the benign warts commonly, and also can cause malignant cancers like cervical cancers, depending on the strain. I mean, if it has got the low risk strain, which is HPV 6 and 11, then it causes benign tumors like papilloma, squamous papilloma, or the anogenital warts. But if it having a high risk strain, which is HPV 16 and the 18, they are going to cause squamous cell carcinoma of the cervix and the anogenital region. Though also, as said earlier, it can also cause oropharyngeal cancers. The oncogenicity of HPV is related to the expression of the two viral components, which are E6 and E7, which binds to the P53 and the RB tumor suppressor gene respectively. I mean, E6 join to the P53 and E7 binds with the RB. Then both are tumor suppressor genes, and when they are neutralized by these, their function are compromised and the proliferation occur. E6 and E7s are from high-risk strains of HPV, which gives rise to the cancer. And the E6 and E7 from the low-risk strain of HPV, and so they are going to cause benign warts, papillomas. Hepatitis B and hepatitis C causes hepatocellular carcinoma. Depending on the endemic areas, like in Asia, hepatitis B is common, so here the most common cause of hepatocellular carcinomas, hepatitis B. While the West SCV is common, so they are the commonest cause of virus causing hepatocellular carcinoma is SCV. The tumor-associated enzymes, hormones, and other tumor markers in the blood, though cannot definitely diagnose cancer, however, they are used for the screening test efficiently and in utility in monitoring the response to the therapy or able to detect recurrence of disease. Like for example, PSA, prostate specific antigen. It is commonly used to screen for the prostate adenocarcinoma and is one of the most frequently used tumor marker. The other tumor marker is used clinically practice include CEA, carcinogenic antigen, and it is for the detection of the colonic carcinoma, pancreatic carcinoma, stomach, and the breast cancers. The other one is alpha fetoprotein AFP. It is produced by the hepatocellular carcinoma or the yolk sac remnants in the gonads, and occasionally also seen in the teratocarcinoma or the embryonal carcinoma. With successful resection of the tumor or the treatment of the tumor, these markers disappears from the serum. If they recur or reappearance, so it signifies that the tumor might recur. The PSA, CEA, and the AFP can be elevated in the non-neoplastic conditions, so they lack specificity and the sensitivity required for the early detection of the cancer. May be useful in monitoring disease once the diagnosis is established or confirmed. And again, going to repeat, and of course, if the treatment is completed of the specific cancer, these levels, these markers should be declined in the blood, or disappear from the serum.